Okay, if you're running a home health agency in Colorado, you know that staying on top of compliance isn't just important, it's everything. So, in this explainer, we're going to break down some critical rules you absolutely need to know to protect your agency and, of course, your patients. All right, let's kick things off with a situation I'm sure you've bumped into. You have a patient, they're planning an out of state vacation, and the family asks if your CNA can go with them, the one they love and trust. What do you say? What's the call? This is a really high stakes question, and believe me, the wrong answer can land you in some hot water. But to figure it out, we've got to lay down some foundational rules first. So before we can even think about tackling that complex travel scenario, we have to make sure our daily operations are absolutely rock solid. That brings us to these foundational checks that you just can't afford to miss. First up, let's talk hour limits. This is a big one. When your agency is providing both private duty nursing and long-term home health CNA services to the same patient, there is a hard cap on those total combined hours. For your pediatric members, that's anyone 20 and under, the max is 24 hours. For adults, so 21 and up, it drops just a bit to 23 hours. Your scheduling and billing teams need to have this memorized seriously, because it's key to avoiding any overbilling headaches. And that leads us right into what I call the golden rule of documentation. Everything has to match. The hours you request on the PAR and order on the plan of care must be a perfect one-to-one match with what's documented in your visit notes. So if that POC says care is from 10 p.m. to 7 a.m., then every single visit note better say 10 p.m. to 7 a.m. This is such a common tripwire during audits, and it can lead to some seriously painful and expensive clawbacks, so you've got to be diligent here. Okay, let's shift gears and talk about something that happens all the time in our world. A patient decides to switch agencies. Let's walk through how to handle this change of provider, or COP process, so it's as smooth as possible for everyone. Here is the single most important thing you need to remember when you're bringing on a new patient from another agency. Their existing, already approved prior authorization request, it follows them. This is fantastic news, right? It means you don't have to start that whole authorization process from square one. The approval is portable, which makes the whole transition of care so much easier. So what does this look like in the real world? Well, first, the patient decides they want to make a change. Then, as we said, their approved PAR follows them right over to you, the new agency. Your job is to submit a completed COP form and a new 485, the plan of care, that perfectly mirrors the existing authorization. As long as you're not asking for any changes, that authorization just keeps on rolling without a single hiccup. But, and you really need to hear this, the moment you, as the new agency, ask for more hours, the game completely changes. A request for an increase in hours is not a simple transfer. It triggers a brand new, full-blown medical review by Essentra Health. That means more paperwork, more supporting documentation, and a whole new clinical assessment. So remember, a simple transfer is easy. A transfer with an increase is a whole new ballgame. Okay, so now that we've got our daily rules and transfer processes locked down, let's circle back to that big vacation question. It's time to finally dive into those tricky out-of-state travel rules. Let's ask it again straight up. Can a long-term home health CNA from your Colorado agency pack their bags and travel out of state, or even out of the country, with a member on vacation? The short answer is yes. But, and this is a massive but, that yes comes with a huge warning label. Your agency is 100% responsible for compliance. This is not a simple green light. Think of it as a conditional yes, where the entire weight is making sure everything is legal and above board falls squarely on your shoulders. Now, to really get why this is so complex, you've got to understand something called the Nurse Licensure Compact, or NLC. Basically, the NLC is this agreement between a bunch of states that lets RNs and LPNs have one license that works in any other state that's also part of the compact. It makes their license portable, which is super convenient. So who gets to be in this club? Well, RNs are in. LPNs are in. But notice who's missing from the party. That's right, certified nursing assistants. CNAs are absolutely, definitively not part of the Nurse Licensure Compact. And that right there is the heart of the issue. A CNA certification that was issued in Colorado is only good inside the borders of Colorado, period. It gives them zero authority to work as a CNA in any other state. So if you know the CNA's license isn't portable, but you can still give the okay for travel, what exactly are you responsible for? Well, that brings us to your out-of-state checklist. This is what your agency has to do, no exceptions. All right, here's your action plan. Step 1, you have to pick up the phone and contact the Board of Nursing, or whatever the equivalent is, in the destination state or country. You have to verify their local rules and make sure your CNA is even allowed to practice there, maybe through some kind of reciprocity. Step 2, your duty to supervise that CNA's care does not stop at the state line. You have to maintain it, no matter where they are. Step 3, the travel plans have to be officially written into the member's care plan. And Step 4, you need your own formal internal document that shows your agency officially approved this whole arrangement. You skip any one of these steps, and you're putting your agency at serious risk. Wow, we have covered a ton of ground, from daily hour limits all the way to the fine print on out-of-state travel. So for this final section, let's boil it all down to the key takeaways that will help you operate with more confidence and, well, more clarity. So what are the absolute non-negotiables? First, know those daily hour limits cold: 24 for peds, 23 for adults. Second, become obsessed with making sure your PAR, POC, and visit notes are perfect copies of each other. Third, remember the good news, that approved PAR follows the patient when they switch providers. Fourth, never ever forget that CNA licenses are state-specific. And finally, if a CNA travels, your agency, and your agency alone, shoulders 100% of the compliance burden. You know, there's a quote from our source material that just nails it. By understanding these compliance requirements, agencies can ensure that they operate within legal boundaries while providing necessary care during travel situations. See, this isn't about putting up roadblocks to care. It's about making sure that care is delivered safely and legally, which protects both the patient and your agency. So I'll leave you with this question. Based on everything you just talked about, what is the one compliance process your agency can take a look at and improve this week? Is it how you audit your documentation? Is it your procedure for handling a change of provider? Or maybe, just maybe, it's finally time to sit down and write that formal out-of-state travel policy. Taking those small, proactive steps, that is the real key to long-term compliance success.